WNTM.
Breaking news straight from the source. This is the Sean Hannity Show.
I said this once or twice, but it bears repeating. And you can keep your plan if you are satisfied with it. If you like the plan you have, you can keep it. If you like your plan and you like your doctor, you won't have to do a thing. You keep your plan. If you like your health care plan, you'll be able to keep your health care plan. If you've got health insurance, you can keep it. If you like your health care plan, you will keep your plan. If you've got health insurance, you like your doctor, you like your plan, you can keep your doctor, you can keep your plan. If you have insurance that you like, then you will be able to keep that insurance. If you like your doctor or health care plan, you can keep it. If you like your health care plan, you can keep your health care plan. If you like your health care plan, you can keep your health care plan. If you like your private health insurance plan, you can keep your plan. If you like your health care plan, you can keep your health care plan. If you like your private health insurance plan, you can keep it. If you want to keep the health insurance you got, you can keep it. If you like the insurance plan you have now, you can keep it. And if you like your insurance plan, you will keep it. So if you like your plan, you can keep your plan. If you like your plan, keep your plan. If you like your current insurance, you will keep your current insurance. If you like your plan, you can keep your plan. If you like your plan, you can keep your plan. If you're happy with what you got, nobody's changing it.
All right, that, of course, was the big promise. Now, they did get rid of the individual mandate. That was part of the economic package that the president got through. But at the end of the day, there are two things that I preferably would like to see done by Congress before the midterm elections, which I am saying will be the most important in your lifetime. This is a referendum on whether or not Democrats get to overturn a duly elected president. Because, you know, the two things they are running on. Well, three, actually. One, they want to impeach the president. Two, they want to raise your taxes, and they want to take away your tax cuts. And three, they'd love to keep Obamacare. Three huge things. And we know how many millions across the country are paying so much more for far less than they've ever had before. And yet what frustrated me the most during that entire healthcare debate was the fact that innovative solutions like health savings accounts and healthcare cooperatives, you know, for 7 years on this program, we've been putting Dr. Josh Umber on from Wichita, Kansas, Atlas MD. And this is a guy that you pay $50 a month as an adult, $10 a month as a child, unlimited care. He personally, his whole cooperative negotiates directly with the drug companies. They have all the prescription drugs. You need a prescription. You walk out of the doctor's office with it in your hand. You don't go to a pharmacy. And on top of that, you get catastrophic care at a high deductible, the highest you can afford. And that covers, God forbid, cancer, heart attack, or a really bad accident. And those things weren't discussed. So before November, I think Republicans ought to keep their promise fully and completely. And the other thing is fund the wall completely as well. Those are two issues that I think would help them in November. Joining us now is Senator Dr. Bill Cassidy of Louisiana. Senator, how are you?
Hey, Sean, I'm great, man. Thanks for having me.
You know, a lot of your colleagues hate coming on my program. What happened to them?
I'm not sure I'm on your program. Maybe it's one Irish guy speaking to another Irish guy or a conservative to a conservative, but whatever, I love it.
All right, let me ask you about the possibility. Do you agree with me it would be helpful to Republicans to get these two issues off the table? Two big promises that they made: repeal and replace, and also the opportunity to fund the wall. That, you know, that's a 75-25 issue for the country.
Absolutely. Couple of things. Let me just say regarding health care, you know, Trump said he wants to drain the swamp. Right now there's a huge swamp in health care in which everybody's making lots of money, but it's the patient, it's the family paying more and more in premiums, deductibles, and copays. And so if we can drain that swamp, it's going to not only fulfill a promise, it's actually going to also help the average family be able to afford the rest of their life a lot much more. And I think that would be a great way to go into the midterms.
Yeah, no, I agree. Why, when the debate over health care came up the last time, I mean, I read Patient Power, I don't know how many years ago, it was put out by the Cato Institute by Musgrave and Goodman, I think. And, these were healthcare savings accounts. And it's just amazing to me that, here we have talked about all these things. That never came up during this discussion. That was never a bill presented. Except for you. You and, and it was just going to, between you and Rand Paul, I think you're the only two that talked about healthcare cooperatives.
So in terms of the what you described with the doctor from Wichita, we call direct primary care. We have a bill we've introduced in order to make direct primary care law of land. I can also say that I worked with John Goodman. You mentioned him earlier. We had a bill both with Pete Sessions, then with Susan Collins, then with Lindsey Graham, which heart and soul was stuff that I worked on with John Goodman. And the point being, you give the patient the power. If she gets the power of price, for example, if you order a CT scan on her son's belly, she actually knows the cost of it before she goes to get the test. And if she doesn't like the cost, she can go to someplace else, same quality, but a lower price. Imagine that. You know the price before you go in as opposed to find out later. Also, health savings account reform, all into that. A health savings account gives the patient, as you described earlier, the power to control her own expenses. And that way, if she gets cancer, she goes into the catastrophic, but she can control her expenses. You combine it with price transparency, and all of a sudden you have a functioning market that's lowering cost.
Yeah, look, I mean, I poor Dr. Josh Umber. Now, he's been able to institutionalize the things that he does for his patients in Wichita. There's almost 1,000 places now that have opened up, similar practices. Could you imagine unlimited care for an adult, $50 a month, and you get everything except the heart attack, the bad accident, or the cancer taken care of, and that could be handled through an inexpensive catastrophic account?
And the nice thing about it, the doctor is your advocate. So if you need a colonoscopy, I'm a gastroenterologist, so I think about these things. I'm told that someone like Josh doesn't just send you to their friend or doesn't just send you down the street without further investigating, going to send where you get the best price, the best experience. Because otherwise, why would you go back to Josh? Your experience reflects upon your experience with Josh. And so there's a vested interest for that doctor to make sure that you get the best wherever you go. That's a good thing.
Yeah, no, I agree. What made you become a doctor? Become a senator after you're a doctor. And I know Rand Paul, same thing. Why would anybody want to go to Washington? What's wrong with you? I mean, are there some underlying issues that you need to have dealt with yourself?
At its best.
By the way, there's no wonder why people won't come on my show, because I'm a jerk. I wouldn't come on my show either. I'm just teasing.
No. At its best, medicine and politics is about serving another person, taking as much knowledge as you can put together and bringing it to a point for that one issue, that one patient, that one diagnosis. And I'm privileged to do both, and I kind of, when 20% of the nation's gross domestic product is healthcare, having experience as I have is a fantastic way to approach being a senator.
I got to tell you, I really like your state of Louisiana. I've been down there a number of times. I know you guys have had a lot of catastrophes over the years with Katrina and some other catastrophes, but it's such a great state, wonderful, heartwarming people. Then you got, it's definitely represents everything that is freedom, crazy, and fun, especially if you include Mardi Gras and all that.
Well, I kind of chuckle, but you can say that our state, we were the only state that came into the Union, and they published the articles in 3 different languages, French, Spanish, and English, and you still see that kind of reflected. You come to New Orleans, and you see that kind of cuisine, which is incredibly distinct, and that's because it's an amalgamation of 3 different cultures. It makes the music, the culture, and the food just incredibly good experience.
All right. I thank you, Dr. Cassidy. We appreciate it. Senator Bill Cassidy of Louisiana.